Hi guys, so I know it's been a long time since I actually made a video, so this is going to be my labor and delivery video. So as far as you guys were concerned, I was supposed to get induced on September 20th, and that's exactly what happened. I went into the hospital that morning. It was 8 a.m. and I went to admissions. They told me that, I'm not sure you're going to get induced today, but we'll go ahead and give you your bracelets and everything like that. So we went up to labor and delivery, and they went ahead and they started me on some NST testing to check if the baby was, stressed or, how her movement was doing. So it's the first thing that we did. After that, the midwife came in and she asked me, why are you getting induced? I don't understand. And I tried to explain to her because apparently they didn't know that I was coming in and they didn't know why I was getting induced. So they were trying to, tell me like, no, you're not supposed to get induced, this is probably not even going to happen, and whatnot. So the midwife went ahead and checked me. She told me I was 1 centimeter dilated, and she did ultrasound to check if the baby's head was down. So she left me in the room for a few minutes, and then when she came back, she told me like, oh, I apologize. Now I understand why they want to get you induced, because my daughter is IUGR. So after they found that out, they told me like, we can't even let you go now. We have to make this happen. So the first thing that they did was go ahead and get me to a room because I was in triage. So once I got to my room, they set me up on the monitors and everything. And she told me that she wanted to try Cervidil first. Now, she did tell me that it's not supposed to cause contractions or it's not supposed to induce my labor, but it's going to soften my cervix. Now, she did tell me it's going to last for 12 hours. After those 12 hours, if it doesn't help, you have to try another 12 hours. So she told me I was going to be there for a long time. So after about 4 hours of having the Cervidil placed inside me, which was like, I believe like this rubbery thing, I don't know. They noticed that I was having a lot of contractions. These didn't hurt at the time, I was good. I wasn't like in pain or anything. I was watching, I think before all that I was watching like Jerry Springer or something. So they were like, we're going to remove it, which I was so happy about because while I was on Cervidil, you're not allowed to go use the bathroom until like 2 hours later because they don't want it coming out. So you have to like pee on top of your bed. Well, not literally like on yourself. They give you like this little bucket thing. But it was so uncomfortable because I had to pee like every 10 minutes. So I always had to ask my fiance or my mom, like, can you guys help me? I need to pee. So they went ahead and removed it, and they told me I was about 3 to 4 centimeters dilated. And the doctor asked me, like, did your water break already? And I told her no. She was like, okay, well, we'll go ahead and break your water. So they got this big, like, hook-looking thing, and they did break my water, which it didn't hurt. I didn't even feel anything. So it felt great. And after that, I told the lady, I was like, I'm not in pain or anything, but, I do want to go ahead and get that epidural just in case I start getting pains. I think that I should have waited a little longer. I shouldn't have went with people was saying because I did do a lot of research and I watched so many YouTube videos on labor and delivery, and everybody was always saying like after your water breaks, that's when the contractions come and they start hurting. But I was doing fine even with contractions before my water breaks. So I think I could have held off more, maybe even went natural, but I went ahead and I listened to everybody else. So don't believe everything that you listen to or read, please. Everybody's different. So they went ahead and they did that epidural, and after that I was relaxed. I think I was just hanging out in bed, talking to everybody, and I started having this feeling like I needed to push, like I needed to poop or something. And my mom's like, no, you don't need to poop. And I was like, yeah, I know I don't need to, but I really do feel it. So they told me, they were like, okay, we'll go ahead and check you. So they did check me, and they told me, like, you're only, I think they said I was like 8 centimeters dilated or something. And I'm like, yeah, but I really feel like I need to push. And I had this really bad pressure on my lower back, like that hurt so much. And my fiance's like, okay, babe, you're about to get one in like 5 seconds, get ready. And I'm just like, oh my god. Because in the monitor, you see like when your contractions go up to like 200 or something, that's like how you know you're about to get a contraction. So yeah, it hurt. Only my back though. Because the dose of amount of like epidural that they gave me wasn't so much. So yeah. So yeah, after like a few more, like an hour later or something, I was like, oh my god, like I really feel like I have to push. Like I had my legs closed because I was so scared that she was gonna come out. So the doctor went in there, just checked me again. She was like, okay, you're 9 centimeters dilated, just give it a few more seconds. So then I see like everybody setting up their room and everything, you know, and a whole bunch of doctors come in and everybody's getting ready. And then the doctor's like, well, let's hope that we can have a baby right now because I'm ready. So she was like, whenever you feel the contractions, go ahead and push. So I was like, okay. So I went ahead and I started to push. I pushed probably like 3 times. And what I mean by 3 times is like for every push that you do, they make you do it. Push like 3 pushes. So let's say technically I pushed like 9 times. And like they asked me like, oh, do you want to feel her head? And I was just like, no, because I was so concentrated on pushing. But I saw it though, you know. So that's what gave me motivation to keep on going. So I went and I pushed so hard. And there you go, she came out. And they didn't get to do skin to skin right away because she wasn't really breathing that well and she wasn't crying. So they took her in and they went to go check on her. And I was just there waiting, you know, I didn't know what to do. I was so sad because she had just came out and I wasn't able to hold her. But they went ahead and they took out the placenta. I started bleeding a lot, like hemorrhaging. So they gave me a shot in my leg to stop the bleeding. And it was just so much blood, and they were getting so scared. They had like a whole bunch of other doctors come in and try to stitch me up and everything, and it was horrible. There was blood everywhere, like it was terrible. So thank God that they were able to control the blood, and I didn't need a blood transfusion, but I did need to stay on IV for the amount, like 2 days. So after like an hour, they brought me my baby girl, and I started to breastfeed her, and she was so beautiful, and I was so happy. She was born at 12:32 a.m. on September 21st, weighing 5 pounds, 14 ounces, 18 inches long. Oh, she's so beautiful. She's sleeping right now, or else I would show you guys her, but she's over there in the living room with my mother. But it was the most amazing experience ever. I do wish that I was able to, you know, have that skin to skin and have my fiance cut the umbilical cord, but unfortunately we weren't able to do that. I do want to mention that I did have a catheter put in, and I heard, once again, don't listen to everybody, that once you peed for the first time that I was going to burn because of the stitches, the catheters, and all that, and it did not burn at all. So I think that I was more nervous of labor and delivery because of everything that I read, and everything that I was so scared of came out to be not what I expected it to be. So I want you guys to know that don't be scared and don't expect, don't plan, don't, you know, do all that, because at the end of the day, nature's going to take its course. Everybody's different, everybody's pain tolerance, everything is different. So it just might be a different experience for you. So after that, I did have to stay in labor delivery for for overnight until 11 a.m. and that's when I got my room. And it was so sad because the nurse came in the morning to tell me that I was ready to go. And when she picked me up, like on the wheelchair, she was like, "Oh my God, like that's so much blood." And I was like, "Yeah, I know. I was bleeding so much, guys, that they weren't able to like clean me perfectly and everything. Like it was just a terrible experience." But overall, I went to maternity and I spent, you know, my nights and days there with my baby girl, and I swear when they would take her to the nursery to give her a bath or just do some tests or something, I used to go walk around and I used to just stare at her, and like if she started to cry, I would cry. These hormones had me going everywhere. But yeah, so then we went home and it's just amazing. Nobody can explain having your little one finally outside. It's one thing to actually feel them in your belly and know that they're there, but another thing is being able to look into their eyes and say, wow, 9 months of pure perfection was growing inside of me. So guys, this is it for my labor and delivery. If you'd like, I can show you my postpartum belly, I guess. I haven't changed anything. I've been like this since like 3 days after birth, so. But I go ahead and show it to you from the side. This is my belly. To the front. And the other side. But, yeah, the only thing that I still have is like the hairiness that the pregnancy gave me. I don't know how to remove that, but yeah, that's about it. Thank you guys. Bye.